Hi guys! So I wanted to do this video blog on an interesting topic to me. It won't apply to everyone really. And actually the subject is on prednisone. As somebody who's had an autoimmune disorder for many years, for like 17 years now, I've had lots of time to get used to prednisone. There are a lot of younger people that are on prednisone, a lot of older people too, but a lot of even younger people that are on prednisone. If you have an autoimmune disorder, meaning that your immune system is overactive, and you have something like lupus or Crohn's or rheumatoid arthritis, um, then you've probably encountered prednisone at one point or another. Also, people that have had transplants, like an organ transplant, like kidney or something, will be put on like a lower dose of prednisone or some sort of steroidal treatment to make sure that the body doesn't reject the organ. Usually those milligrams, like for people who are just given a small dose to not reject their organ, it's usually just a very small dose, and so you really don't see many of the side effects. Now, prednisone is very strange drug. Like, I don't think there is any drugs out there that is like prednisone or the other, steroids. When I say steroids, everybody seems to get it mixed up. These steroids that you're taking are not the kind of steroids that are like bodybuilder type steroids. These steroids are basically just suppressing your immune system. That's their whole job, is to almost wipe out the entire immune system, because people with autoimmune disorders have overactive immune systems. So if you're in a flare, then they give you some prednisone to knock the immune system down so you feel better. Anyway, so I've had lots and lots of prednisone in my life. On low dosages, it can make you feel a lot better, but on high dosages, it can make you feel a little bit better, but you have really, really bad side effects. Now, sometimes like I've had times where prednisone was the only thing that could be used to treat my flare. So, and it can be deadly. Like I have something called Still's disease, which is kind of rheumatoid arthritis. Well, it is rheumatoid arthritis, but it also has lupus type components to it. So it's not just a joint and muscle disorder, it's also a systemic disorder, meaning it affects the whole body, the organs, everything like that, even the blood. So, so prednisone in a high dosage will do many things. And if you ever Googled prednisone, or if you've ever been on it, you would see that the amount of side effects far exceeds almost any other drug out, because it is just, these side effects go for pages and pages. Unfortunately, a lot of these side effects aren't just the side effects with a lot of other drugs that are like, okay, 1 in like a million people have this side effect. A lot of these side effects are side effects that people actually do have. A lot of people have these symptoms. And some of these symptoms, just in the ones that I've had, have been vision problems, like you have cataracts. You can get cataracts easily, so you need to, make sure that you're being checked for that. Also, there's a lot of weight gain, and kind of in two ways. You gain a lot of water weight, and then you also gain, you're like hungry all the time. So then you gain weight because you eat, more, because you feel hungry all the time. And this water weight, the thing that's interesting about the water weight that you gain is that it's in very bizarre places. Like the fat distribution is very strange. So you get a symptom called moonface, which literally is what it sounds like. It's where your cheeks puff out a whole lot, and then you get like a double chin. And even your forehead will get puffy. It's crazy. And then, so it'll get round and puff out. And it really is pretty different. Like, it doesn't look like normal weight gain. Also, in other areas, you gain weight, like on your stomach, like you almost get like a beer gut almost. And then it's just sort of from here down. And then your limbs, like your arms and your legs, actually kind of thin out, which is kind of weird. And then, of course, you also get water. You can get edema, which is like a fluid buildup in your legs. A lot of people have that. And let's see. Other types of problems you have is like acne. You can have really bad acne, hair loss on the top of your head. The interesting thing is a lot of people have hair growth in strange places on their body, like their face and stuff, even women. Let's see, you can have brittle bones. Like I have the beginning stages of osteoporosis called osteopenia because it causes your bones to sort of lose their calcium, and so it makes them very brittle. And then there are other things like yellowing of the skin and easy bleeding, easy bruising. There are a whole tons of things. And the crazy thing is it's not just physical side effects. A lot of these side effects are also mental side effects where it can give you mood changes, it can give you depression and insomnia, which, I mean, you can't sleep on it. It can make you have the shakes and jitters, all sorts of problems. It can even make you paranoid. So there's a lot of like crazy things that you can, have to deal with while you're on prednisone. Unfortunately, there's really only one of its kind. So if you need to be on prednisone, then that's really the only thing you can take for your illness, because doctors don't prescribe it unless they actually absolutely have to because of the bad side effects. So now that you kind of know what prednisone is, I'm going to talk to you about some different ways that if you're having some of these physical problems, some ways that you can kind of help. Now, I'm not a doctor, so don't, any suggestion that I give you, you should make sure to talk to your doctor about it. If it's a serious thing, I don't want to mess up your body because I'm giving you information that, it might not be good for your body, because medicine isn't an exact science. It's not an exact chemistry, so what works for me might not work for somebody else, and what works for you might not work with somebody else. So it's all just dependent on you. But here are some things that I've noticed has helped me out. The most common side effects that people really, really hate are the moon face, and then also something I didn't mention called a buffalo hump. It sounds awful, and it really is basically what it sounds like, is where on the back of your neck you have a strange fat distribution where it kind of builds up and you kind of have like a bigger looking back in your shoulder area. I'm not sure why this happens. I don't think anybody really knows for sure why that happens. The fat deposits are very strange on the body. So something that will help with the weight gain, I mean, you're going to feel hungry all the time on prednisone if you get onto higher dosages. I kind of think of a high dosage anything anywhere between 30 or higher. Usually you're not given more than 80 milligrams of prednisone. In extreme cases you might have more. 80 milligrams is an insanely high dose of prednisone, and you should only be on that for a very little amount of time because it can cause so much damage in your body. Literally what happens is the prednisone that you're taking, because you have a natural hormone, is what it is, in your body that the kidneys produce. It's called cortisol. A lot of people know this from like those commercials that say, for like the diet supplements that say, if you're stressed, you gain cortisol, which makes you gain weight in certain places. And that's kind of true. It does happen. But taking prednisone, literally, if you take more prednisone than what your body makes, then your body will just stop making cortisol. And cortisol is, you need this to live. You need it to survive. It's very, very important. So you can't just get off of prednisone all of a sudden. You have to sort of wean off of it so that your body knows to start making that cortisol again. So it's a frustrating thing, and you can't even just jump off of it, because even if you have all of these side effects, you still need to make sure your body doesn't, go into crazy problems, which will happen. Like your blood sugar will plummet and you can even go into a coma. It's really, really serious. Anyway, if you're on some of the higher milligrams, then you can kind of expect some of these problems. So anyway, getting back to the moon face and buffalo hump and the general weight gain. As far as the water weight gain, here's something that's very important that I've done, because I've been on varying ranges of prednisone many, many times. I've been on 80 milligrams, I've been on 2 milligrams. 80 milligrams, I had many, many symptoms. So for the weight gain, what I learned was that you need to cut out as much salt as you possibly can. Because being on prednisone causes you to retain water, that salt that you intake is going to make it's going to make you hold on to that water even more. So you want to make sure that your body is continuously being flushed out of that water. It'll help with the physical look and actually how you feel too, because if you've ever felt swollen, it's very uncomfortable. So that's something that will help you cut out as much salt as you can. So no potato chips or pretzels or anything, even soups, like even canned soups have lots of salt in it. So watch your salt intake. Also, try and cut out all soda. Soda's not good for you anyway, so it's a pretty good, reason to wean yourself off of soda. That was personally a very hard thing for me to do because I love my soda. Like, I love Mountain Dew. That's like where it's at, man. And so it was hard for me, but I did cut it out because it made me feel better, and it kind of prolonged having some of these symptoms, and it caused them to not be so bad because I was taking care of and watching not to put too much salt or calories in my diet. Eat as healthy as you can. I mean, obviously you're going to feel hungry, so you need to eat. Try and not give yourself huge meals. Little meals throughout the day that's healthy and filling. Things with fiber. It's very healthy for you. Also, drink lots and lots of water. That's going to keep, it sounds backwards because it sounds like if you're retaining water, you should back off the water. That's the exact opposite. Your body retains water because it thinks that it needs it. That's why. So if you're giving your body water, it's going to start flushing it out of your system. And that's exactly what you want. So do those things. Now, as far as moonface, because even if you're doing all of these things, if you're on it for a very long time at a very high dose, then you probably will still be dealing with these symptoms. For women, it's kind of nice because you can use makeup to sort of contour your face. You can, and I'll give a demonstration of that on another video because it's really cool what you can do with makeup for women. And then just sort of even your hairstyle, changing your hairstyle and not have anything that cuts you right there and accents your cheeks will definitely help. You can elongate your cheeks instead of making them look a little puffier, let's see. Other things that you can do. There's a fly in here. Crazy. Anyway, so also, and always ask your doctor about this because it can conflict with medication, so please talk to your doctor. If you add a diuretic onto your medications, diuretics flush out your system, all of that water. Again, with diuretics, you absolutely have to drink lots and lots of water. And one more thing is probably the most obvious is try and exercise. Now I realize most people that are on these, that are on prednisone, they're on it because they're sick. But even just moving where you are, if it just means lifting your hand or lifting, a little can of, soup or beans or whatever, just getting yourself as active as you can. Walking around the block if you can. Just, lifting your legs in bed or lifting your arms up. Anything will help. If you're starting to feel better and you think you can go out, go walking. Go do things that'll keep you moving and keep your body just getting rid of the extra calories and the extra salt and keeping the fluid down. It's very helpful if you do those things. Okay, then we're going to move on from the weight that it can cause to, we're going to talk about the acne. I didn't really have a whole lot of problems with acne. Some people have it, like for me, for some reason, it made my skin really, really thin. But if, or I'm sorry, did I say thin? I meant really, really smooth. Really, really smooth. Um, but I have had friends that have been on prednisone that have had really bad acne. So you just want to keep your skin nice and clean. Try and use some sort of soap that kind of keeps it a little bit more dry instead of oily. You're basically going to take care of your skin like you did like if you had regular acne. So go over the counter and buy something. If it's really bad, your doctor might prescribe you something, but you can use like Oxy or Neutrogena. Those are good products for use. Or even what's that one that they always show on TV? Um, Proactive. Proactive is good too. Okay, so that's really all there is to that one. Just keep yourself clean and try and just, you know, use that if you need it. Keep applying it, even if you don't see anything, or even if it starts to go down, keep applying it to make sure that it stays away. This other thing I had, and it's a very frustrating thing being a girl. So at high levels of prednisone, you will have weird hair growth, like in other places. Like I would get it like right there. And so you never, like if you're a girl, you don't ever want to put a razor onto your face. That's never, you know, it just is so wrong. So what I would do is I would just take there's these little things that you can buy now that are like, they use heat to get the hair off. So that's a really easy thing to use, and because it goes way deep down in the root, then you don't have to do it as often. That's what I had to do. And then you can obviously use cover up and makeup to kind of help, you know, sort of shade around those types of things. Then there's hair loss. I haven't experienced hair loss on the top of my head, but I would imagine just keep shampoos available to you that are not very harsh on your hair. There are several shampoos that I was actually looking on Amazon for the other day that people use when they have like chemo treatments. If you Googled them, you could find products that work very well, and you can find them at like Sally's or lots of different places, or you could order it online, and that'll help. Try not to dye your hair while you're on prednisone, because that can kind of cause your already brittle hair and already hair that you're losing to possibly come out quicker. Because I mean, dyeing your hair there's some harsh chemicals that are being put on your head, so you want to be careful. That's sort of what patients that are undergoing chemo will do, is just be very careful with what you put on your hair to preserve what you do have. Let's see, what are some other ones that I can tell you about? Really, that's a lot of the physical traits that I've really experienced. There's sometimes you can get like a yellowing of the skin. If you're a female, you can obviously use some sort of foundation or something to kind of even that out a little bit. And then the bruising, easy bruising, just be really careful what you're doing. I mean, it will happen. I remember when I was younger, I had something called a PICC line, and they put it like right in my arm, and it's just because I had to get a lot of transfusions, because I actually took a lot of my prednisone through IV instead of through pill. And so they needed to get a vein open, because I was having this done so often that it was like blowing all of my veins. So they needed to put in something called a PICC line that literally runs up your vein. It's actually an artery, and then it goes down sort of into your heart. Not in it, but you know, around it. And you have to be very, very careful how you care for it, because if an infection gets in there, I mean, that's an open area straight to your heart. So that's very, very serious. But anyway, while I was on this prednisone, because it made me bleed so easily, I would have all these bandages and everything on there because I had it all the time. Like it stays in you, and I had a PICC line for probably at least a month and a half. It would like blow up. Sometimes it would just completely blow up. And then there would be like blood everywhere. It was really, really bad. So you will have easy bruising and bleeding sometimes. So be careful. Try not to use any blood thinners like aspirin. If you have a headache, try and use something else that's not so, that doesn't thin your blood so much, because you're having trouble your blood is having trouble coagulating, and that's why it's bleeding so much if you do get cut. You might have to take some steps to be careful what you do in your daily activities. Just if you're going to have something that, if you're going to be doing something that might be like moving or something where you might have the possibility of bruising yourself or cutting yourself, just be very careful. And that's about all I wanted to cover for this one, is some of the physical attributes of prednisone and sort of some of the things that you can do to fix it. There are more, which I'll probably do another video on, but this one is already really long. So if you just want to come back, that would be awesome. I'm going to do a tutorial on how to contour your face if you are on prednisone and have the moon face. I'm going to show you how to sort of elongate your face and kind of get rid of that a little bit, because I know that makes a lot of women very self-conscious, and it certainly did me. That's pretty normal, I think. But there are ways that you can help yourself, unfortunately, if you have to deal with this. And so if you are somebody out there in prednisone, I totally feel you. All my love to you, and I encourage you to take good care of yourself and to enjoy yourself and to try and live life to the fullest right now, even though you're enduring some of these tough things. And then I obviously hope that you get well and can get off of that. So anyway, thanks for tuning in, and I will see you later. Bye.